Hi, my name is Bridget Skillinger, and I'm going to talk to you about borderline personality disorder. So a little bit of history about borderline personality disorder. First, it is something that we are not born with. It's something that is developed throughout life. And how is that? Well, the best way to describe somebody that has borderline personality disorder is kind of like an onion. If you peel back an onion, when you get to the middle of it, there is no core. So that's what I mean by that when I compare that to a person who has bipolar or borderline personality disorder is that the center, there is no foundation, no solid within themselves that they can count on. And I think that's the main key point. There's no solid that they can count on. They're terrified of abandonment. And I will explain to you how that is developed and why that is developed here in a few. But if you look at somebody who does not have borderline personality disorder, in a sense, the normal person, which we can always debate what is normal. But anyways, they're like apples. So like an apple, there's a core, okay? So you can peel back many, many, many layers of an apple, but when you finally get done, in the center, it's going to be a core, which we're going to compare that to the fundamental sense of being human, the feeling connecting to the human race, the feel of empathy. They can put themselves in other people's shoes, okay? And they don't have the fear of abandonment like a person that has borderline personality disorder. Or in a sense, not a sense, but also be referred to as PPD, which I will refer to in the rest of my presentation as BPD, borderline personality disorder. So it's been debated as more of a complex trauma disorder that was believed to start very early in interaction between infant and caretakers. So what they're saying is this was something that was kind of developed. And they say that women have it more than men. And it's something that is learned passed down through caretaker to caretaker. And so that being said, caretakers who are inconsistent in their response to their babies, such as a delay when they cry because they are angry, because baby's either angry, wet, uncomfortable, or just feeling of insecurity, their brains get wired in a different way than those moms who consistently respond to infants. Infants quickly learn the degree of trust that they have in the world around them. Those that get responded to consistently in a timely fashion in a loving and nurturing way tend to be wired to believe that they have a sense of impact on the world with their actions and their emotions. So by crying, they get responded to. So with that, they have an impact, they have a means, okay? Mothers that are inconsistent in their response, such as delay their response, or they're being irritated or angry when they do respond to their child, or they just fail to respond at all to meet the baby's needs, produce babies that have a brain that's wired, that sees the world as unknown, scary, that has left them, okay? They also have seen, people as, people do like me, people don't like me, sometimes people care about me, sometimes they don't care about me. See, there's where the inconsistency come in. Okay, so now know that the secure child is wired to know that the caretaker is safe. He's a safe place. They know that they can leave the mom or dad or the caretaker to explore the world around them. They know that they can check back in and at any given time, and the reaction will be secure, that they will be welcomed with open arms. Okay. The mom, the mom is giving that baby the reassurance to go out and check out the world around them. Okay, baby that is wired to be that had that inconsistency growing up, they tend to be wired being hypervigilant, anxious about what kind of response they're going to get. They just don't know. They don't know if mom's going to be going to respond with open arms, caring, or are they going to be rejecting them in a sense of go away. So the characteristic traits, consistently fearing abandonment while also fearing being smothered and losing their independence. The middle line of comfort between those two degrees is very thin, okay? Again, borderlines will put all their faith into someone nurturing them right up until that point where that nurturer is no longer there. So this is where the love-hate relationship that I have down here comes in. And what I mean by, let me give you an example of that. So it's like if the borderline calls up their husband, boyfriend, girlfriend, wife, whoever, and they get the response that they're not looking for. So they call them up and they think they're waiting for the response of the person being really happy that they're on the other line, they're calling, and instead that person is busy doing something, so they don't respond in the way that the other person expected them to. They think that they're being rejected. They think that they're not being loved, and basically they're thinking that they're leaving them. So that's where the lack of emotional regularity comes in, or regulation comes in, and being able to regulate that emotion of just saying, maybe they're busy, or maybe they're doing something else that has nothing to do with me. So it's back to clinging to that belief that the mother will reject them yet again, or whoever they are with. So because of this, borderlines have strong emotions, and they're very overwhelming emotions. So all of us have stress in our lives, and we all have emotions that we have to deal with. And as we got older, as young kids, and we tend to grow up, excuse me, we learned how to control these overwhelming emotions, okay? People that have borderline personalities didn't learn how to control that, okay, because of the way they were brought up, the inconsistency. So they learn ways to cope with it. And one of those ways is cutting behaviors or threats of suicide. Now, there's different ways. There are two different things. So they do the suicide thing because if they say they're going to commit suicide, their loved ones say, no, please, we love you, we're here for you. And so they're getting the response that they want or that they feel that they need. Cutting too, they see themselves harming. Their caretakers or their loved ones will stop them from self-harming. But after a while, this is looked at as manipulating, and they're not getting the response that they want. That's manipulating behavior, so they're not getting the response that they want, so they up the ante. So the self-harming behaviors become worse, and the suicide attempts no longer become attempts. They follow through with them, and they never meant to. So that's why we take it very seriously when they do that, and we respond. They say that people that have PPD and the clinicians that's working with them, it is a lot for the clinician. It really is to take on somebody that has BPD because of they need a lot of attention. And they need a lot of attention because they didn't get it growing up. Clinicians tend to misdiagnose them because they think that they are being manipulative. They think that they can actually control their emotions when really they can't. And so I read that some clinicians just don't have the empathy towards those clients. And there are some people that just can't work with BPD people. And so there's nothing against that. It just, again, it takes a lot out of a person. So how do we diagnose people with borderline personalities, especially since it has been so misdiagnosed? Okay, so people that have borderline personality disorders tend to get diagnosed with bipolar disorders. So how do we make sure that doesn't happen? Well, they came up with this McLean screening instrument for BPTs. And this actually is a pretty easy instrument to use, and that was the whole point of it. They didn't want it to be this really long, hard instrument that you have to type in all these things and come up with the answer if they're bipolar or not. So what they tend to do is they have 10 questions, and you answer it either 1 as a yes or 0 as a no, and then you add it up. Anything 7 and above, they say they have the borderline personality disorder. Anything 7 and less, they tend not to, but that's where it gets kind of iffy and where it's inconsistency. So some of the pros of it has become a useful tool of identifying clients with BPD, and it's quick, and it's one paper tool is what they call it. So you just need your pen or pencil to do it. Not tested in a lot of general communities. There's been small test studies for this, and like I said, anything 7 and above, they found out to be consistent that yes, that person does have borderline personality disorder. Anything 7 and less is an inconsistency. So that's one of the biggest cons. And to me, that's a huge con. We're trying to figure out, do they have this? So once you do find out that a person has this disorder, then what, right? What do we do then? Well, we then treat it. Okay, and how do we treat borderline personality disorder? We treat it with dialectical behavioral therapy, or DBT. Cognitive model targets distress tolerance, interpersonal skills, emotional regulations by how? Cognitive model focuses on distress tolerance and interpersonal skills and emotional regulation. It is intensive treatment where the client does both group therapy and individual therapy at the same time. And the therapist needs to be available 24 hours a day, 7 days a week, to help the borderline work through the crises that arise as a whole point of approach for them to not feel abandoned. Remember, the borderline personality disorder, a person who has borderline personality disorder, feels very abandoned, and we don't want that. So if a crisis comes up and they haven't strengthened the DBT skills, their therapist needs to be there to help walk them through those skills and to use those skills and to strengthen those skills. If she's not, they're going to feel abandoned and they're going to go into the self-destructive behaviors again, which that's not what we want, okay? And know that the borderline personality sees the world as gray. Not gray, black and white. Gray is scary to them. Gray mimics the inconsistency they received as an infant that has wired their brains to feel insecure. So they need black and white. They need consistency. So if you're going to do something, if you say you're going to do something, follow through with it. Be very consistent, okay? There are some medications out there that can also help people that have BPD. It can help the client better control or learn how to better control their emotions so their emotions don't feel so overwhelming and that they can cope with them. The two classifications that they have is the antipsychotics and the mood stabilizers. So that's my presentation on borderline personality disorders. Thank you guys for listening and have a great day. Bye.